As of this morning, North Carolina has 40 confirmed cases of the new coronavirus COVID-19. We know that there will be many more to come. The good news is that we have no deaths to report and that all of the cases can be traced to travel outside of the state or contact with a known positive person. However, we know that this will change. It is likely we already have community spread, which has yet to show up in the testing. And we know that more people will get sick and that lives are in danger. Therefore, reasonable but strong actions are needed now to help suppress the spread of this virus and to save lives. Today, we take another step. North Carolina bars and restaurants will be closed to sit-down service and limited to only takeout or delivery orders starting at 5 p.m. today. We are in unprecedented times. This will be a hardship, not only for the restaurants and their owners, many of which have voluntarily closed, but also on their customers who find comfort at their chairs and tables. It will also be a hardship for the employees who depend on them for their jobs. We did not come to this decision easily, but North Carolina must keep fighting this pandemic with the right weapons. On Saturday, I ordered restrictions on large gatherings. There was guidance to restaurants and bars to keep more people separated. I commend those who took this guidance seriously. Unfortunately, some have not. So today we're ordering them to close. Takeout and delivery will still be allowed, and please know that grocery stores will remain open. I know there's a natural tendency to stockpile food in emergencies, but I urge people not to go overboard. Leave some for others, especially those who can't afford to buy a lot of food all at once. I recognize that this decision will cost people their jobs. So this order also brings them some relief. Today, I am taking down some of the barriers to unemployment benefits in response to this unprecedented health crisis. My executive order does, among other things, 5 important things. First, it removes the 1-week waiting period to apply for unemployment benefits for those workers who lose their jobs. Second, it removes the requirement that a person must look for another job during this time when so many potential employers are closed and social distancing guidelines are in effect. And I know that many employers will want to hire many of their employees back when this pandemic subsides. Third, it allows employees who lose their jobs or in certain cases have their hours reduced due to COVID-19 issues to apply for unemployment benefits. Fourth, it permits applicants to apply for benefits remotely by phone or online. And finally, it directs that employers will not be held responsible for benefits paid as a direct result of COVID-19 claims. These changes are designed to lessen the hit on our economy and workers' wallets. We know people want to work and that businesses want to stay open. The reality is that many can't. We believe that there will be additional help for both workers and businesses from the federal government, and I urge Congress and the President to act. People are out there helping each other every day, and I want to commend the businesses that have stepped up to aid their employees, their customers, and their communities. But the new reality is that people will be losing jobs, and businesses have lost customers. These are unsettling times, I know some people are afraid. Some are angry. Many are worried. But we will get through this. You have my personal commitment and the commitment of my administration to work tirelessly and make the very best decisions that we can. Some things are just going to have to change for a while. On Sunday, my daughter came home from school. As much as I wanted to give her my usual hug, I didn't. Other people are waving at and talking to loved ones in nursing homes through outside windows. Small businesses are telling their employees they have to let them go for a while. People are waiting for test results. Frontline healthcare workers are bravely carrying on, treating patients and preparing for the surge. As North Carolinians, it's time for us to be at our best, to not lose sight of our shared values, to be kind and to look out for one another, to pray for each other, to be smart, and to remind others to do the same through our words and our deeds. This will be a long and difficult road for us to travel. But we are North Carolinians, and we are resilient. And even as some things change, who we are will not. We will learn from this, and we will be better than we were before.